Section 3, Procedure. There are 6 basic steps to apply the ear well. 1. Trim the hair around the ear. Use the battery-operated trimmer included with your kit to cut the hair around the infant's ear. Lay the blade parallel to the skin and move through the hair as you would a comb. Cut to about 2 centimeters beyond the perimeter of the posterior cradle. Be thorough in trimming, since successful adhesion of the cradle to the skin is predicated on a smooth surface to which the posterior cradle is applied. Use the adhesive side of paper tape to remove any loose hair from the skin surface before proceeding. The trimmer can periodically jam. Separate the 2 blades by sliding the locking mechanism down, removing the detachable blade, cleaning each, and reattaching and relocking. 2. Prep the skin with alcohol. Use the provided alcohol wipes to clean the area. Generally, 2 packets of wipes per ear will do the job. You may notice that some infants will cry because of the cold, wet alcohol. Permit the alcohol to dry thoroughly for a minimum of 30 seconds before proceeding. 3. Apply the posterior cradle. The posterior cradle can be thought of as the foundation to which all of the other components of the ear wall system attach. Therefore, positioning the cradle is the most crucial step. Before applying the posterior cradle to the baby's ear, first separately remove and then replace each of the tabbed paper release liners from the bottom of the cradle. This will simplify their removal when the cradle is on the child's ear. Pull the ear through the cradle and set the cradle against the skull. You may wish to use a cotton applicator to help manipulate the ear through the posterior cradle. After the ear is passed through the posterior cradle and the cradle sits on the skull, lift the ear and make sure that the posterior conformer on the posterior cradle rests near the retroauricular sulcus of the infant's ear. The retroauricular sulcus is the fold or crease where the skin reflects away from the skull onto the back surface of the ear. Proper positioning is fundamental to a successful result, and also probably the most challenging aspect of the procedure. The posterior conformer, as mentioned, resides behind the upper third of the ear, slightly below the helical rim and 1 to 2 millimeters outside the retroauricular sulcus or the sulcus. It should be oriented so that it is in line and parallel to the upper third of the sulcus. It is important to reemphasize that the posterior conformer should not touch the sulcus, and to allow 1 to 2 millimeters for growth. Before proceeding, check to make sure that the ear rests comfortably within the inner perimeter of the cradle. Also, allow some room for 2 weeks of ear growth. If the ear overlaps or aggressively presses against the vertical wall, remove the medium cradle and select a large cradle for the application. Once the posterior cradle is correctly positioned and properly sized, remove the paper release liner that is covering the adhesive on the bottom of the cradle. The liner is split into 2 pieces with individual release tabs for easier removal. Many physicians like to remove the liner that sits in front of the ear first and then proceed to remove the liner that sits behind the ear. It doesn't matter which order you follow. Prior to removing the paper release liners, lift any untrimmed hair from beneath the adhesive. After the liners are removed, make sure that the posterior cradle is fixed securely. Use your fingers to press all parts of the cradle, including the adhesive footing. 4. Apply the retractor. The retractor is a versatile component that permits a standardized procedural protocol with consistent, positive outcomes. There are 3 sizes of retractors provided: large, medium, and mini. Typically, the large retractor is used with a large cradle, and the medium retractor is used with the medium cradle. The mini retractors furnish supplemental help in forming the helical rim and scapha. A mini retractor should only be used in conjunction with a medium or large retractor when additional forces are needed to shape the ear. For example, when there is severe lidding or profound helical rim irregularities. Use a retractor, or combination of retractors, that most closely match the size of the helical rim of the infant's ear. Begin by shaping the medium or large retractor, which contains an aluminum insert. This allows them to be contoured toward the desired slope of the ear. Using your fingers, bend the medium or large retractor so that it approximates the desired shape of the helical rim. Position the retractor so that it does not overlap the posterior conformer that is residing below the ear. This is a crucial step, since ear compression between the retractor and the posterior conformer can result in unwanted and potentially damaging pressure. You can lift the ear to visually confirm that the retractor does not overlap the posterior conformer. Once the retractor is in proper position, glide the helical rim into the groove of the retractor, making sure that the retractor cups the rim. Finally, remove the liners on the inside of the posterior cradle to expose the adhesive, and attach the retractor to the posterior cradle. Note that there are two adhesive strips, one horizontal and one vertical. Press the retractor so that it will adhere to the adhesive securely. The sole purpose of both the vertical and horizontal anterior adhesives is to hold the retractors in the proper position until the attachment of the anterior shell. Since many ears are not wide enough to reach the perimeter, it is not necessary that the retractor actually touch the adhesive on the vertical cradle wall. If it becomes necessary to place a retractor or a combination of retractors at the top or near the top of the ear, there may be too little available space for comfortable positioning. Their placement could also introduce the possibility of the retractors overlapping the posterior conformer below the ear. Increased space at the top of the ear can be achieved by snipping 2 millimeters from the top of the posterior conformer using a sharp scissor. This simultaneously reduces the possibility of overlap of the posterior conformer. However, it is important to visually reaffirm that the position of the retractor in relation to the posterior conformer confirms that there will not be any overlap from above. Care should be taken to avoid cutting through the bottom support when trimming the posterior conformer. 5. Insert the conchal former. Now you're ready to place the conchal former over the concha. The conchal former exerts downward forces to deepen and expand the conchal bowl, decrease the height of the vertical conchal wall, and to decrease the conchal mastoid angle. These therapeutic actions are instrumental in contributing to the correction of prominent and cup ear and directly correct the conchal crus. Since its insertion benefits the correction of most ear deformities, it is recommended that a conchal former be inserted with each new procedure. It should be noted that the conchal former may result in tissue irritation on the concha. If abrasion is observed during a removal and reapplication, it is easily resolved by delaying the insertion of a new conchal former until the following application or when healing is apparent. Informing parents of this possibility in advance of the procedure will go a long way to minimizing their concern if any irritation is revealed at any point during therapy. Proper positioning of the conchal former is necessary to a successful outcome. The open end of the horseshoe-shaped vertical base should face forward so the auditory canal is not obstructed. The legs of the horseshoe should straddle the concha when possible. The upper leg should reside against the upper vertical wall of the concha and below the inferior limb of the triangular fossa. The lower leg should reside against the inferior vertical wall of the concha. Note that the conchal former should exert vertical downward pressure onto the concha when the anterior cradle is applied and snapped into the posterior cradle. Typically during the initial application, the conchal former exerts sufficient pressure solely from the attachment of the anterior cradle. Subsequent reapplications may, however, require an attachment of the supplemental conchal foam to raise the height to continue exerting downward pressure. Attach a piece of the provided foam to the top of the conchal former by removing the paper release liner and pressing the foam adhesive against the top of the conchal former. This will increase the height of the conchal former, allowing the anterior cradle to now exert the necessary downward pressure when it is attached. If undecided about the necessity of adding foam, lay a long wooden cotton applicator or tongue depressor across the top of the inserted conchal former. If the applicator can touch, or if it is within 1 to 2 millimeters of the top of both walls of the posterior shell, then foam should be added to assure continued downward pressure. If, in your estimation, the attached conchal foam resides too high above the posterior cradle vertical wall, It is acceptable to horizontally cut the foam to reduce its height. 6. Applying the anterior cradle. The anterior cradle will hold all the applied components in position, as well as apply downward pressure on the conchal former. It will also help to maintain the ear's position throughout the treatment regimen. You will notice that there are male tabs on the anterior cradle and female slots on the posterior cradle. Orient the anterior cradle over the posterior cradle so that the male and female parts align. Then merely insert the male tabs of the anterior cradle into the female slots of the posterior cradle. Physicians usually like to engage the tabs in the front of the ear and gradually work around to the back of the ear. After attaching the anterior cradle to the posterior cradle, once again make sure that there is contact between the conchal former and the anterior cradle. As noted earlier, the anterior cradle should lightly push the conchal former downward into the conchal bowl. If there is no evidence of pressure, remove the anterior cradle, add foam to the conchal former, and replace the anterior cradle. Once the anterior cradle of the ear well is applied, inspect the ear to be certain that there is no blanching. Blanching means that there is too much pressure on a portion of the ear. You can easily spot this because there will be whitening of the ear. In order to relieve the pressure, simply raise the anterior cradle slightly.